The English Nurse by Professor Charles Lane Olmsted. Chapter 2, Bones, a Gimcheon University presentation. Vocabulary: clavicle, clavicle. Tibia, tibia. Fibula, fibula. Sternum, sternum. Mandible, mandible. Patella, patella. Humerus, humerus. Vertebrae, vertebrae. Scapula, scapula. Ribs, ribs. Rib cage, rib cage. Radius, radius. Cranium, cranium. Ulna, ulna. Femur, femur. Phalanges, phalanges. Pelvis, pelvis. Ilium, ilium. Wrist, wrist. Ankle, ankle. Carpals, carpals. Metacarpals, metacarpals. Tarsals, tarsals. Metatarsals, metatarsals. Fracture, fracture. Sacrum, sacrum. Stress fracture, stress fracture. Simple fracture, simple fracture. Coccyx, coccyx. Compound fracture, compound fracture. Cast, cast. Splint, splint. Crutch, crutch. Prefixes, suffixes, and abbreviations. Ab or abs means away from, off, away. An example: abduction, moving the limb away from the midline. Ad, AD, increase adherence to or near. Adduction, moving limb closer to the midline. Anter or antero, front. Anterior, near the front. Dorse, dorsey, or dorso, upper side or back. Dorsal, back of an animal. Osteo, pertaining to bone. Osteoporosis, when bone strength weakens. Sentence patterns. Practice the following sentences. The words in parentheses are interchangeable. He has a simple fracture of the lower leg. He has a compound fracture of the lower leg. He has a displaced fracture of the lower leg. He has a non-displaced fracture of the lower leg. 2. She will need to be in a splint for 6 weeks. She will need to be in a cast for 6 weeks. 3. We will wrap it because it is a broken rib. We will wrap it because it is a broken clavicle. We will wrap it because it is a broken metatarsal. He will be in traction because it is a broken vertebrae. He will be in traction because it is a broken femur. He will be in traction because it is a broken pelvis. 5. He can't move too much because he broke his radius. He can't move too much because he broke his tibia. He can't move too much because he broke his fibula. Did you know there are 206 bones in the adult human body? A child is born with 270 bones, but many fuse together as the child develops and ages. The purpose of bones is to keep us sturdy and protect our internal organs. Many bones are attached to muscles, tendons, or ligaments, which aid in the body's movement. The largest bone is the femur, which connects the hip to the knee. The smallest is the stirrup, which is inside the ear. Man and woman both have 12 pair of ribs. A person has 24 vertebrae, plus the sacrum and coccyx. There are 3 sections of vertebrae: cervical, C1 to C7, thoracic, T1 to T12, and lumbar, L1 to L5. The body is described by the position and direction of the skeleton. The front is ventral, while the back is dorsal. The extremities are distal, away from or farthest from the trunk. Proximal is toward or nearest the core. Movement away from the body is lateral, and towards it is medial. Positions: anterior, front of the body; posterior, back of the body; superficial, on the surface; deep, away from the surface; inferior, situated below; superior, situated above; lateral, pertaining to the side; medial, pertaining to the middle; prone, lying face down; supine, lying face up. Reading: bone fractures. There are 17 types of fractures of bones. They range from a stress fracture, small cracks, which can heal in a few days, to comminuted, which is a bone breaking in several pieces and may take months to heal. Fractures are either simple or compound. A simple fracture is closed and does not pierce the skin. A compound fracture is open and pierces the skin, which runs the risk of infection since the bone and muscle are exposed. A stress fracture is a crack or cracks, called fissures, in the bone from repetitive pressure. It is common among runners, basketball players, ballet dancers, and other athletes, usually occurring in their shins. A simple fracture is more serious. It is breaking of the bone, but without damage to the surrounding tissue or breaking of the skin. The area will usually be immobilized by being put in a cast, depending on the location, for a few weeks. Generally, a person can participate in non-contact sports 4 to 6 weeks after the injury, and in contact sports 8 to 12 weeks later. Both are pending doctor's approval. A compound fracture is a broken bone that pierces the skin. This is more painful and can cause infection because the muscle and bone are exposed. This, most of the time, will require surgery. Fractures are displaced or non-displaced. When the bone is broken in two, it can stay in alignment, non-displaced, or it can lose its alignment, displaced. There are also distinguished if the break is complete or there is still some connection between the two fragments, incomplete. A green stick fracture is common in children, where a bone is only broken on one side. It tends to heal quickly. Another fracture common in children is a buckle, where the bone deforms but does not crack. It is painful. At the other end are pathological fractures, where a bone breaks from an underlying health condition, such as osteoporosis or cancer cells weakening the bone. There are different kinds of breaks depending on the direction of the break. An oblique fracture is when the crack runs diagonal to the axis of your bone. It would be caused by intense pressure. A transverse fracture runs perpendicular to the axis of the bone. A spiral is when the fracture twists around the bone. The linear is when the fracture is parallel to the axis of the bone. An avulsion fracture is a break at the site where bone attaches to a tendon or ligament, and that pulls off a part of the bone. Surgery may be needed if the fragment is pulled far away from the bone. A compression fracture is when the bone is crushed and appears flatter than normal. An impacted fracture is when one fragment of the bone goes into the other part of the bone. Questions. What is the most serious kind of fracture? Why? What kind of fracture might a runner commonly get? What kind might a child get? Why would it heal quicker? 4. Which fracture would the bone twist? If a person had a pathological fracture, would the bone be the patient's only problem? Why? Discussion questions. Have you ever broken a bone? Which bone did you break? What kind of fracture did you suffer? How long were you out? What kind of cast were you in? How was it? Conversation A between Nurse Gina and young Jung. I need to go over the discharge papers about your husband's broken foot. How is he feeling? They gave him a painkiller. He can go home? Yes, after I go over this with you. He needs to come back if the pain does not improve or it gets worse. If he starts having numbness in his foot or toes, or if his foot becomes swollen or red. Also, come back if he can't move his foot or toes. What would cause that? His foot may have gotten swollen and is pressing too much on the cast. Also, call us if he gets a fever of 37.9 or higher, or if the cast gets wet or breaks. I see the photo here of how he can shower. Put his foot in a plastic bag and tape it. Yes, hold it away from the water as much as possible. Sit in the shower on a plastic chair. Also, he should keep it elevated as much as possible. Stack some pillows on a chair for his foot. And put some ice on it for 15 minutes every hour to keep the swelling down. Correct. Make sure a towel is wrapped around the ice. If he has pain, this is a prescription for pain. Try to go with aspirin or ibuprofen first. Don't take too much aspirin. Is he on any medication? No. What about if it itches? When I had a broken arm, I had an itch that drove me crazy. Nothing sharp that could irritate the skin. Do you have any questions? When can he get the cast off? The doctor will check his progress in a week. He will set up another appointment. It usually takes 6 weeks. In 4 weeks, the doctor may put him in a walking boot. Questions. What is numbness? What would numbness indicate? Why must you be extra careful with the cast? Discussion question. Have you ever been in a cast? How was it? More conversation. Practice a dialogue with the partner about a broken leg, finger, and hand. Conversation B between the doctor and Chloe. You have a fractured arm, more precisely, the radius. How bad is it? Not bad. It's a simple fracture, and it's a straight break. It doesn't hurt. They gave you a light sedative. Hopefully you will feel that way until you get home and get some sleep. What is a straight break? It's like a twig breaking in two. It was easy to put back together. How long will I be in this cast? 6 weeks probably. No lifting, no knocking it into anything. Keep it dry. Put your arm in a plastic garbage bag when you shower. I want you back in 3 weeks to see the progress. Questions. Was the patient's skin broken with this break? Was there any extra damage to the bone, such as crushed or twisted? What kind of break is it? More conversation. Look over the different fractures and use some of those to substitute for the fracture in this conversation.